So telemedicine is really different now. I'm going to turn this over to Steve before we give out all the awards for his opening comments. And those of you who are on this because you won an award, congratulations. Those of you who are on this because you helped build the program day to day through Jeff Connect guiding team or operational components, we tend to recognize the people that run this day to day less than the people who step up from the outside. And we never get it perfect. There are many, 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 many more people involved that have done great things over the last year that should be acknowledged. And so I will apologize in advance if somebody's feelings are hurt. But telemedicine is truly a team sport, and everybody at Jefferson, all 35,000 plus employees, have contributed and are part of the team. So apologies if we offended anybody and left anybody out. And with that, I will turn it over to Dr. Klasko.
Thanks. So let me just start out with maybe a personal story, a comment and a warning. That usually don't put those three together, but so my daughter delivered a healthy 7-pound, 15-ounce boy, Berkeley O'Neill, at Jefferson last night at about 10 p.m. And amazing work by the Jefferson team, nurses, etc. L&D nurses at Jefferson rule. But that's not the point. What is the point is right after that, I was in a World Economic Forum panel talking about telehealth AI and the role of the human in the middle and what that would mean to medicine. And I did have a little moment of thinking, as my daughter's baby was getting born, as an obstetrician, like, yeah, we could have telehealth and AI replace me as president. I could always go back to being an obstetrician because we're probably the safest of anything that would get replaced. What was interesting, though, was talking to my daughter about a COVID baby. I mean, she was literally pregnant throughout the entire COVID thing. Most of her visits were telehealth. And it really hit me how the advantages and also what isn't great. So what was amazing was that during the COVID thing, because of our amazing telehealth team, many of you that are here today, she could do almost everything medically that needed to get done and not have to put herself or her baby at risk from going to the hospital. What was also interesting, though, was she said, Dad, I know it doesn't matter as far as medically, because I know me and my baby is fine, but I sort of think it would be good to have somebody just sort of lay their hands on my fundus. It would just make me feel better. I think it was a sort of an interesting comment to me from a lay person of where the boundaries are and what our role is as humans. The comment I'd make is just the fact that we've had Telehealth Awards for as long as we've had them is just such a testament to this team and to Jefferson. While nobody else was really putting tele and health in the same sentence, just as we were the first university in the country under Dr. Barchi's leadership to put population and health in the same sentence, we went all in. And a lot of kudos to Judd and the team that we brought over from that other university. But the folks that were at Jefferson that just jumped into that fray really made a difference. And we'll get into this in a minute, but what I'm in some respects most proud of, and this is what hit me this morning, we had our university site visit, which was incredibly positive. And what they talked about is the amazing integration across two very different universities, Philadelphia University and Jefferson, at a level that they've never seen before. And I think one of the things that I'm most proud of as we celebrate the Telehealth Pioneer Award, which I'll get to in a minute, is that Robert and neuroscience at Jefferson really were the pioneers in telehealth, well before we brought in the team and well before Jeff Connect even got started. And the fact that we've moved them from two separate sort of very different entities to really integrating them across what I would argue is the most innovative self-run telehealth opportunity really makes me proud, because it took a lot of work together. It took a lot of learning from each other, and it made both elements, both the neuroscience element and Jeff Connect, stronger. And then finally, the warning. And the warning is this: we have to stop congratulating ourselves for telehealth and continue to move forward in a couple different ways. I'm advocating, probably one of my main things that I'm advocating for from a policy point of view, is that we stop the darn barriers to telehealth, that we create some national models so different states don't have different regulations. But also, and I don't need to rail anymore on insurance companies, but we're already seeing nationally clawbacks in telehealth, because some of the insurers are, getting back to the, oh yeah, we'll pay you $49 for a telehealth visit and $250 for an in-person visit. We have to come up with a model. And I really challenged Bruce and Ed and Stephanie and the chairs that as we do value-based models, obviously with our employees, we have more flexibility. We're looking at some percentage of premium models, that we make sure that we have some of the most enlightened healthcare at any address, telehealth type models in the country. A visit should be a visit, and the visit should be the most convenient and the most quality visit for the patient. And I think that's the model that hopefully we'll move toward. So I guess it is ironic that we're having this our first virtual telehealth award ceremony. Getting back to my daughter's obstetric discussion, it'll be interesting to do a survey after this, if you decide that this is how we should always do it, because this is telehealth, or if you miss the in-person camaraderie. And I think, getting back to my previous comments, I couldn't be prouder that the Telehealth Pioneer Award has been renamed the Robert H. Rosenwasser Telehealth Pioneer Award. So the award has been presented to the individual or group responsible for a significant innovation or novel approach to telehealth. And Bob is the perfect embodiment of that spirit. So let me just sort of put this in perspective. Bob started the Neuroscience Telenetwork in 2010. So we're pretty proud of ourselves for starting Jeff Connect in 2014. But as with everything, it wasn't just, isn't this a cool thing to do? It was absolutely life-saving for acute stroke patients. And a lot of my philosophy of Jefferson could be the place of healthcare at any address really came from Robert's pioneering. Because Robert explained to me, I think, Robert, the first time I met with you, that, I said, well, we have a great neuroscience effort. This was even before the Farber Institute of Neurosurgery effort. So does Penn. What's the difference? And I remember what you said to me is, Steve, it's real easy to explain. Yeah, great scientists, great clinicians on both sides. To Penn, every one of these places they go to is a satellite of how can I get patients to 36 and Spruce. What you were most proud of, Robert, is that you were using your technology to create the greatest number of level 1 stroke centers in New Jersey, for example. My first reaction was very CEO-ish. Well, isn't that going to, cannibalize, the work that would have come here? And, your answer was very futuristic, that the future will belong to those that can keep care closest to home. And, one of the most emotional moments I had was when we announced the Kennedy LOI, and I'm sure you remember this, Robert. But when it came down to why they chose us, they really had a patient come there and said, I can't tell you the difference it made. My dad had a stroke. We would not have been able, given we're essential workers, or we would not have been able to visit him if we had to go into Philadelphia every day. We wouldn't have been able to afford to park $35 for parking, just going over the bridge. We wouldn't have had the time. The fact that through technology and through the vision of Jefferson Neuroscience and Dr. Rosenwasser, not only did it save my dad's life, because I'm not sure that he would have made it if he had to go to Philadelphia, But the fact that we could see him every day, and we think that made such a huge difference in his recovery. Um, and so I want to bring that up because I've been so proud of everything we've done through COVID. I've been so proud that through this crazy time, we found out we were number 4 in quality and ambulatory care through visiting some of those. But those are numbers, and I can give you the numbers that 80% of the patients seen in our network were able to stay at the neighborhood hospital. That sounds great, but it gets down to that individual person who was able to see their dad or their mom. And I think the other great thing about Bob, and the reason that I'm so thrilled that we're renaming the Telehealth Pioneer Award. I remember when I was at Wharton, they talked about Gillette, and Gillette, their R&D team was always thinking 3 steps ahead of the next blade because they knew somebody would catch up to their blade. And I think that's true of telehealth. We were obviously way ahead of folks in what we did or what we've done in both the neuroscience piece and at Jeff Connect. Well, obviously people are catching up, and the fact that Jeff Connect, the fact that Robert is constantly looking at new ways to get care immediately to patients, whether that's through AI or drones or robotics, like our incredible mobile stroke unit with our CAT scan that we're doing in Ben Salem and going to increase, is really what it's all about. So first part of this is thank you, Bob. Thank you for everything you do. So much of our success is because of you. So now I want to congratulate all of you, the 100 and so folks that are here. All the statistics. We did somewhere around 100,000 visits between 2015 and 2020, and you were able to do almost 100,000 just during the surge. Judd, you remember I came and visited your team in the middle of the surge. As a Game of Thrones fan, I loved the Night's Watch piece because Night's Watch, while they were sort of rough and tumble, were the last bastion against the White Walkers. Nobody really knew what they were, just like we had no idea, still sort of don't, what the RNA encapsulated virus that was rocking our world in a negative way was. But you guys were the first line of defense, and you really were the Night's Watch. But what really hit me talking to patients and students that watched you or were part of this is it wasn't just that you got the patients to where they need to go. You never forgot how scared patients were. You responded quickly, and you amazingly took day-to-day new knowledge that was coming from our amazing clinical team and people like Dr. Gleason and Dr. Zerlo, and brought that directly into your telehealth visits. Again, I'll give you a personal story. My nephew is in California and was so frustrated with the telehealth offerings there that we got him on Jeff Connect. I think I gave him my license number so he could pretend that he was a Pennsylvania resident. Sorry, Judd.
We're recording this, Steve.
Yes,
We're
okay,
recording this.
Well, it won't be the first time I've gotten in trouble, but he he's just so impressed of how different it was. So I just think that that I'm just so impressed with what you folks have done in turning this into a 4-pillar model. And I love 4-pillar models. And what I mean by that is obviously the clinical pillar, obviously what you were able to do with our employees of getting so much of the care out from our expensive, inefficient EDs and unscheduled care through Jeff Connect and through the great work that our payer team did with Aetna and our TPA for our employees, while a lot of the insurers didn't get it. But also looking at it from the educational point of view, the National Center for Training and Education in Telehealth that taught thousands of physicians, your fellowship in telehealth, and what you've done and what we've been able to do even in some of the philanthropy and innovation efforts. And then I guess finally, I just want to talk about Jefferson for a minute. because I've never been prouder. I've been here for, I'm on my 8th year. And while, we might not get the kudos that we deserve in the newspapers, by far, in every aspect, this has been our best year. And so I thought I would give you some facts, just so you have them as you move forward. We took care of among the largest numbers of COVID patients in the nation. I think what I saw officially is that we were probably number 25 in the nation. I think the first 9 were in New York, probably almost twice as many as anybody else in Philadelphia area. And we had among the lowest employee infectivity rates in the country. And I just want to say that for a second, because that fact probably cost us $50 or $60 million. And that fact is not an accident. It started out being prepared for a pandemic well before we knew it, thanks to the work of Dr. Zerlo and others around our pandemic preparedness team. So we had something like 60 days PPE on hand before we started. It started out with an absolute commitment, and I use the word absolute, around living our values of putting people first, doing the right thing, and being bold and thinking different. So we never flinched when our changed policies, when gallons for a while went up from 20 cents to $11, and we're using thousands of gallons a day. We never, ever, ever got into that trap of you can get KN95s for 1/100th. I just remember getting all these emails from folks on my entrepreneurial world. Look, all of your other colleagues in Philadelphia are doing these KN95s from China and saving millions of dollars. And I would send it to our heroic supply chain and to Ed and Stephanie and say, thank you very much. We're not going to do that. So that 0.8% or so employee infectivity rate clearly was not an accident. I think it's important to know that while the pandemic hit, and as Judd said, we couldn't have predicted it, hit at a very, very, very vulnerable time for us, just as we were integrating and executing 5 or 6 different mergers with governance as currency. Just so many heroes in what we did in bringing those things together around ventilator strategies. The medical staffs, the boards said, forget what we said about Abington being Abington or Kennedy being Kennedy. We're going to do what's right. We'll suspend our bylaws. So wherever ventilators have to go on behalf of the community, whatever we have to do about who's going to get one, we'll do that. It's important to recognize we're growing at a 10% rate in our clinical enterprise. And I couldn't be prouder that that a lot of that volume is coming back. It's so hard to know as I get the statistics from Bruce and the team of where we are. We just had a discussion with the head of Geisinger, and we're just about on the rate of they are. So we're starting to see that growth come back. I think, please understand, we made a conscious decision, took a lot of criticism for that conscious decision, to do no furloughs and almost no layoffs, other than things that have been pre-planned during the pandemic. One of the only employers in the entire city to do that. Please understand, we have 32,000 employees, so many of whom were not able to really do anything or really do much work during the surge. We just made a decision that that's going to cost us, again, millions and millions and millions of dollars. And maybe if Philadelphia was in a different stage, we might have thought differently. But to take the #1 city in poverty, one of the cities that was enduring one of the greatest rises in unemployment, and recognize that many of those people that probably we would have furloughed would have been some of those very same vulnerable people, we decided not to do that. I think it's also really important to know that some of the heroes that don't get often talked about are the folks on our financial side. That due to our financial stewardship and amazing growth over the past 5 years, our balance sheet is incredibly stable and has remained stable throughout the pandemic tsunami. So, when you look at days cash on hand, which is really what you look at in stability, we're well over 200. We're pretty much where we were prior to 2019. We have not used a cent of our government dollars to this point. So, our stability is there. Obviously, we can't endure too many more years of losing the kind of dollars that we lost last year by doing the right thing, which is why the Jefferson Enterprise Turnaround Transformation Committee work was done. But we are very, very, very stable. And then just a few other facts that that I'm proud of. One of the things that we haven't spent enough time talking about is we're now one of 3 universities that hasn't given in, that is still running in-person student work, and that's also not an accident. For those of you who know Dr. Tikachinsky and I, we are not twin sons of different mothers. We come from very different vantage points. What he is amazingly good at, being a professor of pathology, is taking a vision and turning it into a 157-page handbook, which is what we had to get our students back to class. By the way, that handbook that was developed by the academic team is being shared with places like Haverford, Swarthmore, and others. The only 3 places that have been able to maintain students in this area are us, St. Joe's, and University of Sciences, and obviously we're probably the most complex of those entities. And then finally, I'll just say this, that I take some pride as the leader of this organization that we've maintained our optimism and maintained our unbridled commitment to innovation and strategic partnerships while all this is happening. I've listened to my colleagues that run large health systems sort of talk about how hard it is to run a large health system. I've watched my colleagues who are presidents of universities talk about how hard it is. And I've watched my colleagues who are large employers. Well, we're all 3 of those things. And, I could talk about any of you. I'll just mention, I've mentioned finance. I can't be prouder of what our IS&T group has done, led by Nasser Nizami. And, we're doing EPIC in the Northeast and Abington, and that's going to cost us $41 million at a time where $41 million matters, but we're doing it because it's the right thing to do, and our doctors and our patients need it. Oh, by the way, we had to change everything we did on the academic side as we were moving 2,700 courses online. Oh, by the way, as we did this Better Together fund of $7 million that we raised and gave out a few thousand grants of almost couple $1,000s each for our most vulnerable employees, we needed IS&T for that. So we just have so many heroes. And finally, our commitment is to our community, to our patients, to our students, and to our 30,000 plus employees. It will always be to that. And I was proud of the JET work because at the end of the day, if we were HCA or we were UPMC, we would have had a less of an operating loss. We also would have laid off 2,500 people. And the fact that we spent about 5 months looking at how could we make the decisions that we made that would allow us and you to keep as many of your colleagues working here, recognizing that we had to make some changes. The fact that we worked to make sure that those changes most affected the people that were earning the most is something that I will be proud of well after I leave. And the fact that we are continuing to invest, the $800 million investment in the specialty care pavilion, that will be the space station between our philosophy that healthcare starts at home, using things like telehealth and the fourth industrial revolution, will be a game changer for us, between us and John Scully and the other advisors, and our investments in New Jersey at Washington Township and Cherry Hill, as well as all the other investments we're doing. So that's a little longer than an introduction, but so much is happening. And I just also, of course, want to give my eternal thanks to Judd Hollander, who made the decision in 2014 to leave the comfortable confines of West Philadelphia with his amazing team and come over to a place that was reimagining healthcare, education, discovery, and hasn't done so bad for either himself or the organization. So, Judd, I'll give it back to you and thank you.
All right. Thank you, Steve, and thanks for the update. Robert, would you like to say a couple words? I know we had not told you you were, but if you would like to, we'd be happy to hear from you.
Well, the only thing I would say is, thank you. I mean, it takes a village or a city to do what we all do. And, I know Maureen's on the call, Maureen DePrince and Pam Kolb. And, 10, 11 years ago when we started this, it was Pam Kolb and I in my car running around to all these hospitals, trying to convince them that this is a reasonable thing to do. But it took an army to get it to this point. And, having Judd and his team join us, you're right, Judd. It gave us credibility because everyone said, "What the hell are you doing?" And I appreciate that. So, when Judd called me that they were naming this award, I said, do I have an impending demise or something? Because usually these things don't happen until you've kicked the bucket. And I called Deborah. I said, Deborah, my wife? I said, Deborah, do you know something that I don't know? I said, but anyway, so I just want to thank the whole team. I want to thank Dr. Klasko, who has always been supportive. I'll go to him with a crazy idea and he'll say it's a crazy idea. Maybe you need to think about it a little bit more, or, those kinds of things. But I think that we've been able to do things at Jefferson. I came from New York University. I was at big places, bigger places and bigger cities. And I think we've been able to do things at Jefferson that I don't think I would have been able to do at even University of Pennsylvania or other big places. I think that the spirit of innovation and the spirit of pushing the envelope is what has kept me here 20 years, quite frankly. And the desire to say, okay, we'll take the chance. We'll take the chance on this. And it doesn't always work out, but many times it does. And I just want to thank Dr. Klasko, Dr. Hollander, all the leadership. I see Dr. Marino on from nursing, happen to be looking at her. So I just want to thank the whole team. And that's all. That's all the news is fit to print.
All right, good. Well, thank you. So we are, like I mentioned early on, if you are home or you are in the office, you may have a little white binder outside your front door with your award. If you'd like to get your award immediately after we, quote, give you your award and you don't have it already, that would be great. But we are trying to get pictures of, Dr. Klasko with the award winners. So as I get to each award, if you are not the winner, if you could transiently disappear from the screen on the video so we could have the winners be visible with Dr. Klasko and myself. And Robert, you stay on for the first award. It's named after you.
So Pam Kolb came into my office. We're actually 15 feet away.
Okay.
Pam Kolb is really the person that really was my partner in getting this going, and she really deserves a round of applause also, because she stuck with me.
Okay, well, next year it'll be the Pam Kolb Telehealth Pioneer Award.
That's fine.
But for this year, as Steve mentioned earlier, this is awarded to the individual or group responsible for a significant innovation or novel approach to telehealth. And the winners this year, and we try not to do this, but we just had to. The winners this year are John Carries and DeAndre Carpenter. And the reason why they actually have won the award this year, when COVID hit, in a matter of days, they implemented the inpatient telehealth program across all 14 hospitals. And it was really their vision and their ability to work with their team. And, we got to give credit to the whole IS&T team that worked to do this, and nursing leadership that developed educational tip sheets. But as the visionaries to roll this out and get iPads into 2,000 patient rooms, so our expertise could be delivered to the room even without a physical presence, as we were concerned about physicians and nurses on quarantine, and give patients during this time where there is no visitor possibilities, the ability to do family visits from home. The Robert Rosenwasser Telehealth Pioneer Award goes to John and DeAndre for this year. You got a picture of them on the screen? Okay, good. We got it. All right. The next award is the Telehealth Chairman Award. This is awarded each year to the department chairman who completes the highest number of scheduled telehealth visits. And Dr. Greg Kane wins the award this year. I think he is a repeat winner, consistently, not every year, but consistently doing a large number of telehealth visits. So Greg, thank you for your individual contributions to patient care, as well as your leadership in the Department of Medicine and having all of your faculty roll out very robust telemedicine throughout the past. The next award is the Telehealth Champion Award. And this is awarded to the individual who has done the most physician-initiated calls, and this excludes emergency medicine because we do tele-intake and we do on-demand. And before I announce the winner, I will say that she did 712 telemedicine visits this year, which actually is more than all but one or two departments did in the preceding year. So Jessica Bricker, thank you for your help as Telehealth Champion Award. Jessica, your award is one of the ones that's being delivered because they printed it wrong. So if it's not outside your door, it will be shortly. The next award is the Healthcare Delivery and Quality Transformation Award, which is awarded to the individual or group that best implemented telehealth to transform a care delivery model while maintaining or improving upon the quality of service. And this year it goes to the whole pre-admission testing department at Center City under the leadership of Katrina Harrop, Janine Wills-Ducksworth, and Amy Della Pena. And I will say this is not the first year that they have won a telehealth award. And Janine years ago took this on before the institution was ready for it, piloted the program in pre-admission testing, and showed and published a paper that showed we were able to drive down the case cancellation rate for surgical patients using telemedicine to zero. There were no case cancellations when this happened. So we have now taken that pilot data and under the leadership of this team and many others, transformed the way we're doing pre-admission testing throughout the enterprise. And tremendous thanks from our patients, our surgeons, our anesthesiologists, and everybody for all your hard work, team.
Thanks, Judd.
Sure. We have a Telehealth Newcomer Award. And this is awarded to the individual new to telehealth in the fiscal year who had the most physician-initiated calls. And this number, again, up there with Dr. Bricker's number, is 689 total telehealth visits for someone who just began their telehealth career at Jefferson in this year. So very impressive numbers to Ann Tenthoff. So Ann, thank you very much for your contributions and leadership and jumping on board with Steve Klasko's vision right away. Mike's telling me we got the pictures. So when you take leadership classes, and I don't want to pretend to be an expert in leadership, one of the things people tell you is when you don't know something, you could admit it rather than try and fudge your way through it. And that becomes really important for this award, which is the Outstanding Research in Telehealth Award, which is awarded to individuals conducting telehealth research. And this award goes to Angela Girolamo and Monica. I can't pronounce your last name, so I'm admitting there's something I don't know. So Monica, if you would share with us the correct pronunciation, we'd be appreciated.
It's Pogorzelska-Maziarz.
I think I was very smart for stopping when I did.
No, it's actually pretty easy. I think I get that. Yeah.
Go ahead, Steve. Take your shot.
Pogorzelska-Maziarz.
Very good.
All right, you got it. That's why he's the CEO. So recognizing there was a gap in research on the potential on-demand telehealth to reduce acute care among home health patients, Angela and Monica received a 2019 Jefferson Provost Clinical Research Award to partner with Jefferson Home Health and assess the acceptance and usability of Jeff Connect among home care patients. This was actually our first telehealth-focused research award that went to Jefferson College of Nursing, so breaking new ground here. And the ultimate goal is to develop a pathway to introduce and sustain innovation into the Jefferson home care system. So Angela and Monica are the first nurse researchers to receive this award, and tremendous, outstanding effort to improve our care by putting new knowledge out there. And one of the things that I think Jefferson can be really proud of is we have significant numbers of people in our enterprise that have received funding to do telehealth research. And we are taking care of our patients, but we are learning from them to help others take care of their patients. And so thank you, guys. The next award is another team award. This is Breaking Barriers in Telehealth Award, and this is awarded to the individual group that's most instrumental in helping move telehealth initiatives forward. And this goes to our champions of the North: Steve Spencer, Dawn Ward, Michelle Rasta, Jamie McKenna, and Brooke Mayer. And you guys rolled out telemedicine. We know the North pre-COVID wasn't, our earliest adopters of telemedicine, but you guys did a phenomenal job of getting everybody trained really quickly, everybody onboarded really quickly, and making sure that, honestly, you held my feet to the fire. You created a centralized hub to support the patients and providers during the pandemic. You worked to disseminate it into the practice, and you worked tremendously collaboratively with the telehealth team at the enterprise level to make this work. And you pushed us to have our vendor, Teladoc, really our partner, change the registration process. And we actually had that redone at the vendor level to improve care of the patients. So thank you to this team and all the people up north for truly breaking new barriers and extending our telemedicine program far beyond where it was before. We have a Growth and Access in Telehealth Award, which is again to the group that has contributed most significantly to the expansion of telehealth for our patients. This year, the award goes to the team that led the effort on the e-visits optimization team. Before this year, e-visits came into the primary providers. They honestly weren't that happy with handling the e-visits the way it was working. There was a delay. This team, working with Bracken in the in the primary care network, actually changed the workflow and centralized this through seamless access and telehealth, greatly reducing the variance in patient experience, improving the workflows, and most importantly, making the time until patients got an asynchronous response get cut from days to hours. It allowed us to take an e-visit, which effectively is a structured email through MyChart, get rapid asynchronous care, and escalate the care to be seen via telehealth, in person, or just get an email or e-visit response as necessary, and has folded this into future work with the revenue stream. So Anna Marie, Bracken, Matt, Carol, Regina, Craig, I should add Lisa to this since Seamless Access was a predominant player here. Wonderful, wonderful job. And our numbers are doing really well with this program. The award that is actually, I don't want to give any one group of people priority over other groups of people, but this is the group I sweated it out with. This is the Service Excellence in Telehealth Award. There are only 7 people on this list, but probably 20 people on this Zoom could be named in this. We selected the 7 that slept the least. This award is actually focused on the group that honestly is true heroes and the reason why Jefferson isn't more in debt. This is no exaggeration. Nobody on the list, if you'd roll to the list, Mike, nobody on this list, I believe, slept more than 2 hours for 10 or 11 or 12 straight days when COVID rolled out. If we told the team, you need to go sleep, they didn't. They rotated out for 2 hours. And again, there's many, many more people that did this. But we went, to give you an idea, particularly for those that understand a little bit, or not a little bit, about technology. In the middle of COVID, or early on in COVID, we had a lot of hiccups. We had a lot of call failures. It got as high as 43% of our video visits failing. This crew stayed awake, like I said, for a week and a half and drove that down to what is now 8 or 10% by mapping out everything that could go wrong and approaching it in a very analytical way. Was on the phone with national Vonage engineers, with Teledoc engineers, with Epic engineers, with many, many more people in our IS&T department. And, when people say, what about your job kept you up at night? I may roll over and be awake in the middle of the night, as some of you do. These guys were literally up all night. So I can't thank Kyle, Matt, Stu, Dawn, Mike, Meng, Luke, and the rest of this team. Truly heroes, and they really saved Jefferson during the time of COVID. And the last but not least award, I don't know why everybody says that, but I thought I would do, too, is the Outstanding Education in Telehealth Award. And this is awarded to the 2 individuals that have spearheaded the new telehealth education program. We have talked for years about the National Academic Center of Telehealth. We now have created the National Center for Telehealth Education and Research under the stewardship of Mike, roll with the slide, Shruti Chandra and Tep Ross in the College of Health Professions. Again, a group effort, but these 2 have been leading it. And I will point out that the AAMC came to us, and we are one of 3 programs in the nation being highlighted in a video at the AAMC meeting in November for leading the way in education for students in telehealth. So, again, a lot of people contributing to telehealth across the education across the enterprise, lots of training, but these 2 are standing up nectar and helping take it to the next level. So for that, they received the Outstanding Education in Telehealth Award. And so we actually made it through this, and I think Mike Fox is giving me the thumbs up that we have pictures. So now that everybody is on the monitor, let's have a round of applause for our award winners. And I think, in my closing comments, I will just say that Steve alluded to the fact that I came over here with a group of people in 2014, and Steve gave us the longest leash to grow a telemedicine program. And I've repeated the words he said during that first budget meeting, and I won't again, but it was really, permission to do what's right for the patients and to make things happen. But none of that happens without an enormous team effort. And you on this call and all the people who are not on this call deserve way more credit than I deserve for making this thing happen. I don't do the IS&T, I don't do the programming, I don't do the telemedicine calls like all of you do, or as much as all of you do. So I really want to thank everybody for helping this program succeed, and recognize that any credit I get is overstated because it's not Judd doing this. And when I give the national talks, I say, I have the easiest job in the world because I'm one of the few telemedicine people in the country that had the CEO of the enterprise and the board say, do this. And it's not Judd sitting in the back room coming up with some kooky idea, trying to find money to make it work. So it's been relatively easy. And then it has nothing to do with telemedicine. But during these very difficult financial times, I sent Steve and some others an email. There's some tough decisions that have been made. But I just want to say that I am particularly proud, that even though we've all taken hits and our departments have taken hits, that we prioritize keeping everybody employed as the biggest thing. And, things are a little bit painful for everybody. They will continue probably to do that. But I find it frankly inspiring to wake up every morning and go to work or Zoom to work, knowing that the priorities were in the right spot, which is keeping the most people around. So for that,
could I just say one thing just before you sign off? We consciously changed our mission from, being self-directed of, being the premier academic medical center in Philadelphia to we improve lives. And I just want to say that I hope all 58 of you on this call will, whatever drink you decide to have tonight, will recognize that, we can talk about statistics, we can talk about Jefferson, but you truly, every one of you has improved lives in a way during the most difficult time in many people's lives that would not have happened without your hard work. So that's, to me, that's the biggest thing. It's not where we went out or how many we did. It's that one life that each of you impacted because both of the technology and the human commitment that you made. So I'm sorry, I just wanted to get that out there.
Great. And then I will, again, I started by apologizing that there are invariably people who are left out, that aren't acknowledged, that contributed to your teams. So as you see this out on My Jeff Hub or on social media, if there are people who contributed to your success, and there certainly were, please tweet at them or add them and recognize their contributions, because this is, again, a team sport that extends past the apparently 58 people on the call. So congratulations to all of you who won awards. Thank you for making my job easier, and thank you for helping everybody here take better care of the patients. All right, thanks all. Have a great day.